Did you know there's a new way to stop the growth of kids' cavities? It's just one of the latest efforts to help children prevent tooth decay, which remains a top chronic infectious disease among kids. In fact, nearly 1 in 3 children ages 2 to 5 in the U.S. are affected by tooth decay. So what you don't know about your child's little teeth could hurt them. American Academy of Pediatrics Dentistry President Dr. Jay Miller joins us now to explain why it's so important to make a big deal about the little teeth, especially during National Children's Dental Health Month. First of all, Doctor, thank you so much for joining us today.
Well, thank you for having me.
So what is the latest innovation to help treat cavities and overall keep children's teeth in good shape?
You know, what's one of the latest innovations is using an antibacterial liquid called silver diamine fluoride. And essentially, it's not a panacea, but what it is best utilized for is in situations where, very limited situations where we may have a very young child. That young child may not be really capable or able to tolerate dental treatment at that time. And so we apply that to the cavity area of the tooth, that liquid, and the liquid does kill the bacteria and really helps prevent further progression of the cavity. Now again, we need to go in at a later time, treat the cavity in a more permanent fashion. One thing that's important for parents to know is that when the bacteria do die, it does turn that part of the tooth black. So there is some cosmetic effect. That can be resolved at a later time now.
So do you believe there's a gap right now between parental knowledge and about kids' dental issues and action?
You bet there is indeed a gap. And that gap really falls in understanding the effect on baby teeth with permanent teeth and the whole general health. What we know is baby teeth, and I'll just give you an example. A good example is I have a child that comes into my practice, maybe 3 or 4 years of age. I diagnose that child has a cavity. I advise the parent that should be treated for the child's best oral health. And a question they may have is, well, my child's going to lose the baby tooth at some point. Why do I really need to treat that? And I think it's important for parents to know that that child will have baby teeth, maybe up until middle school, till age 12 to 13. And so a cavity in a baby tooth left untreated has the potential to affect the developing permanent teeth. And besides causing pain and infection, affecting the permanent teeth, that really could result in a lifelong negative oral impact the rest of that individual's life. So that's where the gap is.
So Dr. Miller, what are some of the primary culprits in childhood tooth decay and oral health issues?
I'll identify that in the very young child. The biggest culprit we see is the nursing bottle. And the way that contributes is a child is put to bed at night with a nursing bottle. In the bottle they have milk, formula, juice, pretty much anything other than water. They are asleep several hours through the night, nursing on and off. So many hours of the night, this warm, sweet liquid is in that child's mouth. Now, that dramatically increases the risk for cavities. And that is one of the biggest contributing factors in those very young population. In the more teenage population, we're seeing carbonated beverages, sports drinks, sour candies, those types of things having a significant impact on increasing cavity risk. And the reason for that is, besides having the sugar component in those beverages or candies, they also have an acid component. And so the acid weakens the tooth structure, making the cavity disease process much more damaging.
So doctor, quickly, what are the dangers of tooth decay in young children?
The dangers, as we've mentioned, pain and infection, lifelong problems with that child. I think the important thing that I want to get everybody aware of, the AAPD is really trying to get that message out, is begin early. Age 1 dental visit is critical. We want to see your child by the age of 1. And the reason is because we want to identify any problems, and usually there are not any problems, but if there are, we want to identify those early so we can manage those in the most conservative way possible. Also, and most importantly, we want to be an education source for that parent so we can really teach them how to raise that child so they have a lifelong health of good oral health and good oral habits.
Well, this has been great information. Where can we learn more about good oral health for children?
The number one place to go is the AAPD's website, mychildrensteeth.org. It's packed with information for the parents. not only the parents, but it's outstanding for kids, very friendly, interactive games for kids, and I invite you to go there.
Thank you so much for joining me today.
Thank you so much for having me.